Greetings, I'm Professor Yang Seung-min. Early treatment is very important for treating peri-implantitis. What is more important is that depending on patient condition, you need to find the optimum treatment modality. Today, I'm going to talk about treatment method and the correct timing for providing such treatment. Today, I'm going to talk about when treatment should be provided. I'm going to address the timing. And out of the different treatment method, I'm going to talk about non-surgical treatment method. This can be divided into mechanical method and chemical method. I'm going to address these in detail and then summarize. First, I'm going to talk about when treatment should be provided. The timing will be addressed. Peri-implantitis. When we find it and notice it, when should we treat it? Have you ever asked that question? Should you provide treatment when it is first found or when patient complains of discomfort? Or you may have just left it untouched because the patient is not experiencing any problems. I believe that timing is very important. Let's look at some cases. In the most posterior area, prosthesis has been delivered. Continuous follow-up has been done. 4 years and 7 months later, the patient expressed discomfort. Although it took 4 years and 7 months for the patient to express this complaint, what kind of changes were there that led to this result? After prosthesis delivery, 1 year, 4 months, 2 year, 4 months, 3 year, 4 months, 4 years, and 4 years and 7 months, you can see that around the implant there is bone loss. Patient symptoms surfaced after 4 years and 7 months. However, even before that, bone loss can be observed around the implant. After it was observed, do you see that it has progressed over the past 2 years? I believe yes. After it has advanced, the patient came to express discomfort. If you just leave it alone, there is more possibility of the disease becoming worse than better. In that sense, we need to think about when we need to provide a treatment. We need to think about this point. In order to treat this state, what should we do? Of course, we can approach it directly, but to do it more conveniently, I removed the prosthesis. After I did that, I used different modalities to remove the toxins attached to the surface. In the case of this patient, I used air abrasive to treat this area. 4 years and 7 months later, the disease progressed for 4 years and 7 months. And this is 2 months after treatment and 2 years after treatment. What do you see? This is on X-ray, but you see that there is somewhat healing. This can happen. In my opinion, what is important is that it may not heal sufficiently just because you provide surface treatment, but there is possibility of this. Therefore, when you first find signs of bone loss, regardless of whether patient makes complaint or not, you need to make a decision. Going back to the very first step, when do we need to provide treatment? Earlier the better. That is why maintenance treatment is ever more important. If the patient does not do maintenance care and makes abrupt visits, it's very difficult to manage the situation. Always, we need to provide treatment the moment we find a problem, and in order to reduce such problems, a regular checkup is required. If there is bone loss and if we were to treat it, what do you think is the purpose of the treatment? I have mentioned this in a different lecture. However, the biggest cause of peri-implantitis is infection due to microorganism. The biggest purpose of treatment is to remove the cause of infection, and we have to use different treatment modalities to achieve that goal. How are you going to decontaminate the contaminated implant surface? If this is not possible, are you going to remove the implant thread by grinding it off? If there's a lot of bone destruction, are you going to restore it so that oral hygiene can be maintained appropriately? There are so many options and numerous categories. There are many purposes and goals that need to be achieved, and it's quite complicated. You don't need to remember everything. But from clinical perspective, if you're a clinician, regardless of the disease, if there's peri-implantitis or other diseases, I would try to find measures to stop the progression of such disease and to restore it. I need to find ways to reduce recurrence, stopping the disease, reducing recurrence, and restoring function. These three goals are very important clinically. In order to do this, what kind of treatment is most effective? That is the question we come to have. The perio disease can be treated surgically and non-surgically. And what is more effective is determined depending on probing depths, and you already know this from the textbook. Peri-implantitis, what kind of treatment is more effective? Surgical or non-surgical treatment method. As mentioned before, the primary purpose of treating peri-implantitis is to remove inflammation, restore function, and prevent recurrence. So what kind of treatment would be most efficient? So we can look at different ways to do this. Non-surgical and surgical ways are not separate from each other. After we provide non-surgical method, we resort to surgical method later, so it's all in connection. So it's complementary to each other. Let's look at the different non-surgical methods. We can do mechanical debridement, as well as chemical cleansing. Antimicrobial agents such as chlorhexidine or tetracycline can be used, as well as other agents. Different tools can also be used. Laser detoxification as well as photodynamic therapy can be used to remove pathogens. Surgical method can be used if the disease continues to progress or recur even after non-surgical method has been done. It involves opening flap and treating the contaminated implant surface. You can open flap and you can make it clean. There's also a resective procedure where you open flap, remove implant or other tissues. After that, bone regenerative procedures can be used to restore hard and soft tissue. In this lecture, I'm going to look at non-surgical method and how to apply them. In order to achieve the purpose of providing treatment non-surgically, out of the 6 methods, you can apply approximately 3 of these. The rest cannot really be applied and may have some limitations in terms of non-surgical treatment. As mentioned before, from a clinician's perspective, in order to stop the progression of disease, reduce the possibility of recurrence, and restoring function, the three treatment modalities highlighted in green, if you do it properly, you'd be able to get satisfactory results of stopping progression, recurrence, and restoring function. Done right, it will serve the purpose. This is an image I always show whenever I provide a lecture. You can see that there's a lot of calculus around the implanted prosthesis. Calculus is another area where plaque can live. Once attached to the surface, plaque can continue to proliferate and become a source of inflammation. In order to prevent calculus formation, and if there's plaque formed within the abutment or the implant prosthesis surface, you need to remove it. It's very important. If it's only on the abutment, it's not problematic. However, if it is formed around the implant and causes bone loss, you need to clean the implant at the same time as well. Between rough surface and smooth surface implants, the contamination, it occurs more frequently in rough surface compared to smooth surface. However, we rarely use smooth surface implant, and we need to consider how we are going to non-surgically treat peri-implantitis in rough surface implants. Among non-surgical methods, how are we going to clean the contaminated implant surface? And how are we going to prevent proliferation of such contaminants? We need to consider this. The ways to prevent and suppress it can be divided into mechanical and chemical methods. Various methods can be used to remove the contaminants on the implant surface. Ways to do surface detoxification. There's chemical and mechanical method. In the case of chemical method, you can use various chemical agents such as antimicrobial agent, chlorhexidine, citric acid, hydrogen peroxide. And for mechanical way, you can use ultrasonic scaler. You can also use abrasive, air powder abrasive, or pumice, which we use regularly. Or you can use implantoplasty to remove the contaminants off the implant surface physically. Also, there's photodynamic therapy where special substance is placed inside the sulcus and laser is used to remove the problematic bacteria. Let's look at different drugs used. There are many different types available. There's a lot of different options available. Tetracycline, minocycline type, gel type, or tube types are available. Liquid type, such as chlorhexidine, tetracycline, are also available. You can dilute it using water. In order to access it, you need to open flap in this case. In the case of irrigation, you don't need to open flap, and it can be done sufficiently. We need to consider ways to access the contaminated area on the implant surface in the most optimum way. The most important thing is to have access so that the contaminants of the implant surface can be removed. There are many treatment options available for both mechanic and chemical treatment, and these are what are frequently used. The most important thing is how long do you apply it. On literature, you can do it for 30 seconds or 1 minute. At times, you can do just irrigation, or you can do burnishing or rubbing. Another type is to inject it, or you can rub the drug on the surface. There are different types of options available. Rather than just using one method, be it mechanical or chemical, I believe it is better to combine mechanical and chemical method together. This is well reflected in animal study. However, there's still a lot of controversy in human study. People argue a lot over its effectiveness. However, there are ways to do it most effectively, and this will be addressed in the lecture. Once again, let's look at mechanical cleansing. As shown on the top left side, if you use a physical scaler, you can use a plastic tip, or as shown on the right side, metal tip. You can do it manually or use machine as shown. There are so many options available and the results vary depending on the patient. Therefore, you need to be aware of the indications. Scaler is most notable mechanical cleaning way. You can use air abrasion using tools or using medium which become in direct contact to do photodynamic therapy. As of late, different lasers are available from different companies. Different companies argue that they specialize in certain areas. However, clinically, it has not been proven clearly as of yet. The price of lasers varies significantly from very expensive to more affordable. But what these lasers have in common is that by using it, you can get the sterilization effect. Regardless of the type of laser, you can get sterilization effect. However, it is yet to be clinically proven that lasers are effective in treating peri-implantitis. When you use laser, you need to think of it as a measure to do sterilization. Mechanical ways can be used for non-surgical treatment of peri-implantitis. There are many reasons for failure in these treatments. First is limitation in terms of access to implant microstructure. Because we don't open flap and we're not able to see it directly, we use some tools or chemical materials to access it. Peri-implantitis is in the end toxification or contaminants around the implant body, and you need to reach it directly in order to achieve our desired result. However, we have not opened a flap and the angle in which we access it may be uncomfortable. Therefore, access may be incomplete. Access is very important. Because we're not able to access it properly, it is not removed thoroughly. Sufficient detoxification is not possible due to lack of access, and because of that, when we do chemical cleansing, we are unsure as to how much dosage should be used. These factors can vary significantly depending on different situations. Therefore, it becomes completely impossible to remove the toxins on the implant surface. As shown, we use different ways to treat this condition. However, there's a significant contrast between open flap and flapless treatment. What is most important is that all tools that we use should be in direct contact with the contaminated surface. There are many literature addressing non-surgical ways, and there are many different opinions on its effect. The most important thing in the end is regardless of the treatment method you use, you need to combine them rather than just using sole method. Even if the treatment is successful, probing depth does not decrease or bone does not grow back. However, inflammation as well as bleeding upon probing are improved. However, still yet more endeavor needs to be put in to verify the effect of non-surgical method. To summarize, in order to treat peri-implantitis, amongst diseases around the implant, the most important point is regardless of whether you choose non-surgical or surgical method or chemical or mechanical treatment, detoxification of implant surface is the most important thing. The most crucial thing is for you to have your thoughts in order about how to access and remove the contaminated area. You need to have full understanding of how to do that. In addition, you need to understand how to maximize the effects of non-surgical treatment and make it last long-term. You need to understand clear ways to achieve these goals. As implant treatment became more widespread, there are more research being conducted around peri-implantitis and other complications. Maintenance and care is very crucial for successful implant treatment. If you continue to do research on treatment in this area, you'll be able to differentiate yourself above the others. Thank you for watching.